Moran.
Mr. Chairman, thank you very much. Doctors, thank you very much for your presence and testimony. Let me briefly describe what I think the reason that the CHOICE Act was passed and ask you how it now works in the delivery of mental health services. I think the belief and the evidence was that the VA was incapable of providing the services that were needed by veterans in a timely fashion, in part because there were lack of necessary professionals. And in addition to that, it was designed to help meet the needs of veterans who live distances from a VA facility. So two purposes. The VA, in fact, if you look at the money, $15 billion appropriated for the Department of Veterans Affairs, $5 billion of it to go to hire more professionals, and $10 billion of it to pay for the services outside the VA in communities. And I think the goal here was to alleviate the challenges that the VA has in being able to care for our veterans. So it was fully designed to help veterans get the care they need. My question is, what has transpired on the mental health side of things as a result of the CHOICE Act that has improved the access for veterans who live distances from a facility and the ability within the VA to have the necessary professionals to meet the needs of those who are within the VA being treated?
Well, Senator, the CHOICE Act has provided greater flexibility. It's allowed us to reach out, and with Congress's support, now to combine a number of different programs for reaching out into one and create a new business structure that supports that, which was an essential element, and I think was the hardest part about implementing CHOICE, is creating that business piece that allowed us to work with folks. We have a long way to go, and I want to go back to what was said by the IAVA representative, Dr. Mafucci, that the problem that we face still, and that we have a lot of evolution to do, not just in VA but across the country, is it's not just any willing provider can provide this, because most providers don't have the military cultural competence or the experience in treating deployment mental health issues that exist in VA. So we connect now with people, we can provide more care closer to the veteran's home. That's wonderful, and CHOICE allows that. But now we have to raise the level of quality and the interoperability of our systems. If we can't coordinate care with those folks, then we fragment that care instead. So there are still challenges, but CHOICE has started us on a great path.
Well, I certainly wouldn't disagree with the need for quality care, but I also know that no care or care that's delayed, the quality of that care is zero. And so, in my view, the VA ought to be utilizing CHOICE to meet the needs as best we can of veterans who are either because of time or distance incapable of being currently served within the VA. You talked about quality care and the business model. So for years, before the passage of the CHOICE Act, I've been trying to convince that the VA that they have an opportunity in my state of Kansas to contract with community mental health centers. These are, I think, 40 across the state. County commissioners levy property taxes to pay for these services. The state legislature and governor contribute dollars. And across our very rural state, it's the only place in many instances that there is any access to health care. And our efforts pre-CHOICE and post-CHOICE have been pretty fruitless in accomplishing that. And so I would ask Dr. Cutler, is there someone that you could direct to meet with me and with representatives of Kansas mental health centers to have a direct conversation about how to accomplish, assuming that you agree with my goal, to put these providers and the VA together in a way that after all these years, and in light of the passage of the CHOICE Act, which gives, I think, as you say, more flexibility to you to do that, and to pay at Medicare rates, it seems to me that we're missing an opportunity. I thought it was an opportunity years ago. I think it's an even greater opportunity now. And I just need you to help me put the puzzle together so that it happens for real.
Sir, that's an opportunity it sounds like it would be very important to develop, and I would gladly do anything I can to help investigate that and make that happen.
Please have somebody, you or someone, contact me and let us put the people who know the details of that in front of you.
There's a special team that's been developing the business rules, and I have a feeling that may be where this it belongs, and I will make that happen.
I appreciate you saying that. I have 15 seconds only to remind you, Dr. Cutler, we had a conversation about a year ago about the hiring of particular mental health professionals those being licensed professional mental health mental health counselors and marriage family therapists. And you indicated in your testimony that you'd met with those folks, you had an interest in that. It's not, you indicated, to paraphrase, as I had your quote, but to paraphrase it, it's not happening as fast as any of us hope, but to be absolutely clear, I'm dedicated to doing that. Has your dedication resulted in the additional hiring and therefore access to these professionals by veterans?
Not just in additional hiring, but we've actually, with the help of our Office of Academic Affiliations, created training programs internal to VA to actually produce these professionals in our own area so we can actually grow them ourselves and keep them when they've been trained.
And the statistics would show that those professionals are now available and are being utilized by veterans?
They will show that, sir, and I still think it could be faster, and it will be faster, but it is accelerating rapidly.
Thank you.
Senator